that the number of people with diabetes has gone up 4 times in 40 years with a unique trend. The risk of early death is increasing, unlike other major non-communicable diseases like cancer or cardiovascular diseases. This is as per the data from the World Health Organization. Diabetes, especially type 2, can be managed with lifestyle changes. And today we have a panel of experts who will tell us how we can not just live, but thrive despite diabetes. I'm Miloni Bhatt, and I'm very happy to welcome the panel of expert endocrinologists, starting with Dr. Pramila Kalra, Professor and Head of Endocrinology, Ramaiah Medical College and Hospital in Bangalore. Dr. Kalra, welcome.
Thank you.
We have with us Dr. Manoj Chaddha. He is a consulting endocrinologist, PD Hinduja Hospital and Medical Research Center in Mumbai. Dr. Chaddha, what a pleasure to have you here.
Thank you.
And we have with us Dr. P.K Jabbar. He is the professor and head of the Department of Endocrinology and director and CEO of the Indian Institute of Diabetes in Trivandrum. Dr. Jabbar, a pleasure to have you here with us at the Economic Times.
Thank you. Thank you.
All right. So diving straight into the conversation, Dr. Chaddha, my first question is to you. Diabetes is often referred to as a lifestyle disease. What lifestyle modifications are pivotal for effective diabetes management?
Yes, you've got it right. It's a lifestyle disease with the current scenario that we live in, hurry, worry, and curry. That sort of explains what is happening in just a sentence. So we need to, look at our eating habits, our stress levels, our, in terms of activities that we are doing. We need to have a time for everything. And that also includes that you should be able to sleep on time and get up on time. So all said and done, when we talk about hairstyle and clothes style, the lifestyle also means something that you'll be doing forever, and it should fit you properly.
All right. That's well said. Hurry, worry, and curry. I think that's a promising start to this discussion. Dr. Jabbar, it is said that we are what we eat. So how does a balanced diet contribute to diabetes management, and what dietary guidelines are recommended? A linked question to that is, in your experience, what are the challenges that individuals face in adopting this, and more than adopting, sustaining healthy eating habits?
Good, very nice question, ma'am. See, if I'm quoting words of my own teacher, Dr. S.D. Bhandarkar, okay, sir used to teach us, there is no specific diet for diabetic patient. Only thing is a modification of your diet. Like, say heavy, or, say taking lot of fatty food, lot of carbohydrate, or say like, carbohydrate containing food, is not good. So what sirs used to tell us, you just go for a balanced diet. What is meant by this balanced diet? Which means, take little rice, little curry, take little fish or non-vegetarian, something like that. In addition to that, it is better to take, and probably it's mandatory to take a lot of salad also, which gives a lot of positive energy in terms of metabolism, in terms of your body function also. But there are challenges. I know that say it's not practical to continue or implement all these recommendations completely to our population. But we should try to implement this type of simple recommendation for a positive health. That's the only way, or probably the most important statement from our textbooks, Bible, okay, says the most important step is your dietary modification and your movement, which is exercise. Okay, that's it.
All right. Okay. Dr. Kalra, Dr. Jabbar has already touched upon this because, considering India, the cultural and the regional variations that we have, what are those considerations that need to be taken into account when it comes to lifestyle modifications for diabetes management? So building on what Dr. Jabbar said.
Yeah, so it's a very important question, because when you talk about lifestyle modification, we talk about this with all our patients with diabetes, but problem is none of them actually follow it to the book. So it has to be modified as per individual patients. So when we talk about lifestyle modification, Dr. Jabbar already alluded to the diet part of it, but I'll also talk about a little bit of the exercise part of it, because when we talk about exercise and we tell our patients to go for exercise, they'll say that the time is a constraint and they don't have time. So what we have to tell them is whether they do it in the morning, they do it in the afternoon, they do it in the evening, they should do it. So we don't keep a time for them. So it's not like that they have to do it at a particular time of the day. They can do it as and when they get time. They can change the time every day, but they should do it. So exercises can be of varied types, but what we can tell a patient that in case they're continuously sitting, watching the laptop, working on the laptop, they can at least get up every 30 minutes and walk and come back to their seat. Even that is going to help them. So the lifestyle modification can be done in all the forms with their work routine. If they are going for work, if they are going to catch a metro or a bus, we tell them, okay, go walking and catch it. That's a better way of doing it. Come back walking. That is a better way of doing it, even if you don't have time. And one stationary cycle at home to do cycling in the evening or in the morning when they come back home is a good enough exercise to maintain the health parameters in the right manner. So these are the few things which we tell our patients, which can be matched with their lifestyle and can be done accordingly. Because if we tell them a dedicated exercise routine, most of the time they are not able to follow it.
All right. Dr. Chaddha, building on what Dr. Kalra just touched upon, could you give us deeper insights into the role of physical activity in controlling blood sugar levels for individuals with diabetes?
Okay, so where Pramila left off, let me just add one line to hit the importance of not sitting continuously for more than 30 minutes. We say that sitting is the new smoking. I mean, everyone knows smoking is bad for health and multiple issues, but sitting continuously is as bad as smoking or even worse. So what she said, get up every 30 minutes, even if it's just for a few seconds, it's very good. So we need to have some discipline in terms of whether it is walking or it's a game or it's dancing, some weight training. These can be done very easily at home or in your day-to-day activity. I mean, there are a lot of corporate offices which even sort of encourage you to do it during your lunch break or a little couple of minutes. It doesn't have to be for 2-3 hours. Just a couple of minutes is good. I want to stress another important thing which has come up in the last few years, and that is the importance of bones in diabetes. We hear about osteoporosis and aging problems and fracture risk, but diabetics by themselves are prone to this increased fracture risk even more than a non-diabetic. So that's why whatever we are talking about in terms of control, in terms of lifestyle, in terms of weight-bearing exercise, it's not only going to help the diabetes part, but it'll also reduce the risk of fractures.
But doctor, for if you tell a lay person that, because you're diabetic, and you possibly are at a higher risk of fracture, then wouldn't that kind of keep them away from physical exercises? So, what would you recommend and suggest they do?
No. So when we say physical exercise, whether it is just walking regularly, some sort of dance exercise, some sort of the outdoor games, it should not be a contact sport if that is what someone is worried about.
Right.
But your regular activities, plus when we say weight bearing or stretching exercises, nowadays we have these stretch bands which works on your energy levels. So it's not that you're obliged to carry X amount of weight and then you get hurt, you get stretched. So that's something which can be very easily done, and it has wonderful effect on the muscle and on the bone, both put together. And you don't need to get scared. You can do it, and it really helps you out.
No, those are good and important points. So thank you very much for that. Dr. Kalra, talk to us about the role of obesity management in supporting the overall health of individuals with diabetes.
So when we talk about obesity, we just don't talk about a simple terminology which we say as the BMI. We talk about the visceral obesity. That is a type of a fat which is, we can understand, a bad sort of a fat, which causes more insulin resistance, means the insulin is not able to work properly. and it causes inflammation in our body. And as a result of which, the patients get predisposed for diabetes as well as for cardiovascular disease and high cholesterol values. But one more thing which is also coming up is obstructive sleep apnea. A lot of people have obesity, and because of this they are not able to sleep properly in the night, because they get in between apneic spells, and they get up and their sleep is disturbed, which further leads to higher blood pressure, cardiovascular and diabetes risk. And also one more thing is the fatty liver. Now we use a lot of terminologies for fatty livers, newer terminologies have come up, but basically when the fat is deposited in areas where it is not to be deposited, it causes more problems. So that is the basic concept we can understand about fatty liver. So when the patient undergoes exercise routine or they undergo treatment for all these things, along with lifestyle modification, we try to monitor and see all these factors as well. So it's not just the insulin resistance, it's not just the diabetes or the hypertension or the cholesterol which we are targeting. We are also targeting fatty liver, which is also a big predisposing factor, not only for further cirrhosis or liver damage, but also for heart disease. So that is why with obesity management, we are actually tackling multiple things, including the obstructive sleep apnea, the fatty liver, the diabetes, pre-diabetes, blood pressure, cholesterol, all these things are taken care of. So obesity management is not just management of the weight, it's a percentage of weight loss. So we quantify weight loss in terms of percentage, 3%, 4%, 5%, 7%, 10%, because it has been seen that more than equal to at least 5% of weight loss helps in most of these parameters, including fatty liver, insulin resistance. 3% also helps, but more than 5%, 7% has been shown to be quite beneficial. And now we have multiple methods in apart from the lifestyle modification, including drugs, which can help in reducing weight to that extent, even beyond 10 to 15% of target as well, which also to some extent helps in reducing the insulin resistance and can also help in remission of diabetes, which we talk nowadays about remitting, or the diabetes can go into remission. Yeah.
Right. All right. All good points. Dr. Jabbar, though Dr. Kalra touched upon it, do you think you could go slightly deeper into stress management? And, how can stress management techniques positively impact blood sugar control, and also maybe, give us a little more, tell us a little more about the role of sleep in managing diabetes?
It's a beautiful question, I would say, right? Because see, stress is and diabetes, it's an interlinked issues, right? Okay. What I used to tell to my students, if the blood sugar is not under control, just think about their psychological health also. Maybe they are having some stress, hidden stress, or whatever type of stress which can develop or which can contribute to uncontrolled diabetes mellitus. And very interestingly, Dr. Pramila Kalra was discussing about, say, some sort of sleep problems and all. For a normal individual, you should sleep at least say somewhere around 6 to 7 hours. Okay, perfect sleep you should have. Otherwise, there are a lot of medical conditions which may accompany your sleep problems. One of the problem, again, Dr. Kalra's discussion, obesity. See, certain type of obesity, see, Dr. Pramila was discussing about visceral or truncal or abdominal obesity, which is very, very, very dangerous. In addition to that, this obesity patient, they will have a small neck. So the issue of the small neck is they're prone for snoring, excess snoring. Don't think that, say, simple snoring is abnormal. No, it's not like that. Excess snoring, which is mounting to your respiratory problems, okay, colloquially speaking, stopping of respiration, which is a very important medical illness now. See, previously we thought in a snoring, chalega. It's not like that. Now, snoring has got lot of implications. All right? Okay. Your diabetes difficult to control. Your hypertension difficult to control. You may be having personal or sexual problems, and your personality changes. What will happen? During night time, you are not sleeping. In fact, you are sleeping, you think that you are sleeping, but your oxygenation of tissue is not proper. So eventually what will happen, You will go to your office and you will get irritated, easily irritated, and you will have problems in your office or with colleagues. All those problems, it's not that uncommon. And but I want to convey a message that, see, if you have a suspicion of this storing problem, okay, you should try to sort it out, because this has got various implications, including, well, sorry to say that, that can produce certain accidents also. So what I want to tell you that, just think about these problems and try to correct it. Mind you, these are all absolutely correctable with surgery, without surgery. There are simple method like weight gain also will reduce your snoring. So in short, snoring is a very important medical problem which carries lot of implications also, which has to be tackled. Okay.
Dr. Jabbar, if you could focus on the stress management aspect of it, and
Yeah,
how will
yeah.
that
Your stress
help?
management, I told you, stress management, you can manage 2 or 3 ways. One, simple lifestyle modification. All right. Okay. And just like when we were discussing, sleep properly. All right. Okay. And there are certain other methods also, like yoga is a good method. Okay. I would say yoga is one of the best method for reducing your stress. Even exercise will reduce stress. Okay. And of course, if you can't control these problems without medicine, sometimes you may have to go for advice from your physicians, and sometimes you may have to go for medications also. Short term, don't go for a long term treatment. Okay. Yeah. Over to Manoj sir. Manoj sir want to add.
No, just 2 things to add to what Dr. Jabbar added. One is work during your work hours as much as you need to work to finish your assignments, your targets, etc., etc. But once you get home, try to switch off. You want to work from 8 to 8, it's fine, but switch off at 8:01 and get back home with no homework. Only classwork has to be done like in school.
Right.
The second thing is, like in so many countries abroad, taking leave at regular interval is absolutely compulsory. Here, someone recently told me that I have about 1,000 days left to retire, and I've got 1,040 leave accumulated. So that's not a good idea.
Correct. Next.
All right. Okay. Dr. Chaddha, if you could, give us more on this, the importance of regular monitoring to gauge the effectiveness of lifestyle modifications. What do we need to do?
I think that's very important. When we are looking at a modality of treatment, we keep talking of drugs, we keep talking of injections, but diet control, activities, lifestyle control, whatever we are saying, has an equal, if not more important role. And the simple thing is, everyone should be encouraged. When I say everyone, I mean the patients. They should be encouraged to monitor the sugar at home. It doesn't have to be 4-5 times a day like we do it for children on insulin. But even if it's once or twice a week, it gives them an idea where they are going. It gives them a sense of achievement when they see that these numbers are coming down. They need to go to the lab once in every few weeks or every few months as suggested by the doctor. But I can assure you, as Pramila used the word of remission in diabetes, that is a reality. It's not fiction. But provided you respect your body, take care, and monitor at regular intervals as suggested by your physician, depending upon what sort of treatment you are. And I think the best set of patients who are only on lifestyle without any medications are the ones who can talk in terms of reversal or remission.
All right. And there are so many devices that we get at home to monitor diabetes. Are these sufficient, or are there specialized devices that people need to invest in?
Oh, we've got glucometers, which have been around for a couple of decades now. And now we've got the glucose sensors, which the patients can apply on their arm by themselves
Right.
now. And they're available, like you would say, off the shelf. You don't even need a medical prescription for it. But they're expensive. But at least it gives you a sense of where you're going. If you're doing something wrong, if you're cheating, how good or bad is that? So when you say monitoring, I think the best thing that can happen to a patient is if they take care and take control of their life, then their dependence on outside things like medications would definitely go down.
All right. Okay. Dr. Kalra, this is now my last question, and it is to you. Can you give us a few practical tips for incorporating healthier choices into daily routines, especially for, so many of us who say that they have very busy lifestyles?
Yeah, so when we talk about healthy routine, we start from sleep, I would say. So there is a term which I always use for my patients, is a sleep hygiene. So sleep hygiene means when they go to sleep, they should just keep their mobiles, laptops, everything away. Because whenever patients come to us, they will ask and tell us that we can't get good sleep. And then I ask them, how do you try to sleep? They tell that I sleep with my mobile, I keep on seeing it, and when I get the sleep, I just switch it off. I tell them, no, mobile should never enter your bedroom. So mobile, laptops, screens, bright screens should be away. Good sleep is the best things. That is the sleep hygiene. Then we come to the diet. I don't tell them to change their dietary pattern altogether. I tell them to modify the diet, like add more of salads, add more of greens, add more vegetables. If the patient has good control of diabetes, we allow them fruits to some extent, 100 to 150 grams. If they have poor control, we tell them to restrict. And also protein in adequate amount, because what happens, Indian diet is high in carbohydrates, but it is not very high or very good in protein. So I tell them to add more of pulses, curd, milk to their diet. Also, if they are non-vegetarian, they can take egg white. That is going to be helpful. Coming to the exercise part of it, I tell them to inculcate a daily habit of doing it. I tell them, like you eat food, you breathe, you dress up, you do makeup, you should also think that this is more important, because if all these things can only be done if you're healthy. So exercise is integral part. I tell them, like if you're going to the office, you can get up every half an hour, do this. I practice the same in my practice as well. When I take a patient to the dietary room, I go along with the patient. The patient feels happy. I also get that 1 minute of walk. So this is a way we can do it. We can inculcate in our daily practice as well. Also, I also tell them that on the weekends, don't go out and do binge eating, because people think enjoying on the weekend is going out and eating. I tell them enjoying on the weekends is going somewhere but not eating. Just see the things, enjoy, come back home and eat. That is the best way to do it, because if you eat outside, you end up eating unhealthy food. And even if you're eating outside, make healthy choices. Decide what is good for you. Don't do binge eating. So these are the practical tips I would say I give to my patients. I also tell them that please follow regularly with your doctor, because many a times the patients feel that if I go to the doctor, they'll find out something and they will give me some advice and they will start some medications. I tell them that it's always good to follow. It's always good to go to the doctor, get the things tested, and the treatment can be done accordingly. So these are the practical points I think we can all follow, including us in our daily lives.
All right, and these are all fantastic, easy to do, maybe hard to follow, but I think if people sort of inculcate it as a routine, then, for the sake of their health, it will be beneficial to all. So Dr. Pramila Kalra, Dr. Manoj Chaddha, and Dr. P.K Jabbar, thank you so very much for your insights, for your thoughts, and for all the directions that you have given us today.
Thank you.
Thank you.
Thank you very much.
Thank you, ma'am.
Thank you.
Bye.